So this gets into the hot topic now, droplets versus aerosol. And I brought this up with you after reading this amazing article in The Atlantic by Zanab Tafacci. And she's been writing on COVID, just these extraordinary articles. This one was titled, "We Need to Talk About Ventilation." And it brought up this debate. There's kind of a divide in the scientific community between the infectious disease experts, especially long-timers like yourself, and these aerosol scientists. And that divide, if we can get it down to a scientific number, one of the major issues was that the infectious disease folks have grown up, like yourself, thinking that a droplet less than or greater than 5 microns, which is micron is the measurement of the distance, the width of the droplet, and a drop of water, by the way, like a raindrop, has 1,000 microns. So 5 microns or up usually is taken care. The old way was usually it's taken care of gravity and it drops down, and that's why we have the 6 feet apart. But the aerosol scientists have been saying, no, we've known forever that stuff heavier and bigger than 5 microns floats around for a while. Fog, when we pass through fog on the highway, that's like 15 to 20 micron droplets, and they're floating around. You've been hearing from some of these aerosol scientists, I know. I think the 5 micron thing was actually a little wake-up moment for yourself. How are you looking at this debate now? How much of the spread of COVID is happening through droplets coming out of coughs and sneezes versus droplets floating around?
Yeah. Peter, I don't know the answer to give you an arithmetic number, but what I'm learning now and what I'm seeing is that I am assuming that there is a degree of aerosol transmission, and I don't know what that degree is. And the reason I say that is twofold. One is that there have been circumstances of epidemiological reports of restaurants and other places where the situation was such that it had to be aerosol. It had to be something that was recirculating in a room because people were getting infected that were nowhere near the 6-foot aerosol. So that's one reason why I'm keeping an open mind.
Right.
You spoke in the beginning about your activist history. It's almost like, I started to listen to the activists years ago. Now I'm starting to listen to the particle physicists.
Yeah.
Because I was getting emails from people and say, you got to read this. So I get 2,000 emails a day. So you got to read it. Click, I delete it. Until finally I got one from someone who I happen to know. It said, Tony, please read. So I don't know. I was in a soft moment. I said, oh, okay. So I opened it. And it happened to be somebody who I had, communicated with in the past. And they got me in touch. They sent me some things to read. And the particle physicists absolutely insist, and I don't think they're crazy at all, saying that for one reason or other, the medical community has bought into the concept that all particles that are more than 5 micrometers drop, like you correctly said, and anything that is less than that can float around for minutes or however long you want to be. And they showed me data that are things that I don't fully understand because there's a lot of physics, but showing that depending upon airflow, moisture, or what have you, that clearly particles that are 7, 10, 15, 20 or more micrometers can actually float around.
Right.
So they're not talking necessarily about virus. They're talking about aerosol.
Right.
So I think we need to keep an open mind and say, based on our evolving knowledge that we're learning from the aerosol / particle physicists and the epidemiological situations that point to some form of aerosol spread, I would think that the assumption you need to make is that I don't want to get quoted on what percentage of transmissions are through aerosol, but I'd have to say there are some. And that only makes me feel things that we both have been saying for a long time.
Right.
Wear a mask, keep a distance, avoid crowds, and importantly, which you pointed out to me strongly a couple of months ago, outdoors clearly better than indoors.
Right.
And when indoors, circulation to the extent that you possibly can.
And you're right. I know this freaks people out because they're like, it's in the air. Oh my God. We're not talking about something that persists in the air outside and or in an inside setting that it's going through a building's circulation, ventilation system to all the offices. It's not that airborne. But in certain circumstances, almost invariably inside a room where there's not ideal air circulation, where it's stale air, that's where the aerosol can hang for a while or kind of recirculate within that room.
Right.
And that's where our problems can really occur. Is there a chance? I mean, some of these scientists are saying that they are speculating based on the fact that we really don't have many case reports of outside transmission, for instance. Mm-hmm. Is there a chance that aerosol is accounting for more than half? I mean, can we rule that out?
I don't think at this point, Peter, we can rule any of that out. I think we don't know what the percentage is. Let me make a comment that just triggered something in my mind that you indirectly brought up. Oftentimes in our concern about either scaring people or taking things out of context, we don't say something that is reasonable and true and would be helpful if people heard it. So we're having a conversation that there is, we both believe, some degree of aerosol transmissibility, which should alert us in a positive, value-added way of being very careful about circulation when you're indoors and keeping windows open and making sure that you're attentive to this possibility. It's almost as if some people, maybe me a month ago, 2 ago, would be hesitant to even say that because you're afraid that the next headline is Fauci says the virus is in the air. And the next thing you know, people are going to say, I can't go outside. And that's absolutely not what we're talking about.
That's the opposite. Because the same physics experts, the same aerosol experts, explain that these, and they do it with, I love how the cigarette smoke analogy. They explain that these aerosol clouds that form when we're breathing kind of right here and when we're talking kind of right here, way out in front of us. And then they might float around if it's stale air in a room, that once you open a window and open a door at the opposite end and get just a touch of cross circulation, and especially if you're outside, that cloud it gets diluted almost immediately. It falls apart and you get to that viral load question again, where it's the difference between smoking in a room with all the doors and windows closed, one person smoking, eventually you're going to see it. Mm-hmm. Versus smoking outside, you can stand 8 feet away and you can see the smoke wash away and dissipate pretty quickly.
Right.
So it's how these clouds really fall apart on outside versus inside. And I think it makes the going outside, in addition to masks, almost an equal public health message, that if you can do things outside, you are lowering your risk by many, many, many factors. Am I
Agree.
right?
Absolutely agree.
Right. So, and this goes, and so now that we know all this, some of our public health messaging may have been backwards. Early on, when we made everyone stay in their apartments, maybe we should have had outlets for people outdoors. Maybe governors closing beaches and parks was not the best idea. And we've had these scenes where the media goes out and they take a horizontal video of a beach with 1,000 people on it in the next mile, and it looks crowded from horizontal. But if they had a drone, everybody, there'd be little clumps all 6 feet apart. That's a pretty safe environment. And it would be a form of harm reduction to say that would be our outlet.
Right.
I know you stuck with don't do crowds.
Right.
But there's a difference between an outside crowd and an inside crowd. And this is where Rand Paul tried to trip you up, not this week, but 6 weeks ago when he challenged you, where he tried to say Black Lives Matter. Why aren't you shutting Black Lives Matter down? These demonstrations outside. And he was comparing it to the government regulations that you've supported that have shut down restaurants and bars and churches and gyms.
Right.
All of those were indoors.
Right.
And
that was apples and oranges. Right.
Apples and oranges. And so these outdoor things, especially in a marching formation where people are not usually standing next to the same person for long periods of time, there's a shifting that happens. And over 95% mask wearing outside. I think that's why we've seen virtually no transmission at BLM rallies. And we have contract tracing data on that,
right.
Correct?
Correct.
Yeah.
And that's the reason why you see in the 5 Fauci things that I talk about all the time.
Outside, inside.
That's right. And I really feel strongly that is the case. Also, that is the reason that heightens my anxiety as we get into the fall and winter months, when in many cases people are going to be forced to spend more time indoors. And that's the reason why I keep pleading with the American public to try to get our baseline level of infections down below the unacceptably high level they're at now, which is today and yesterday was up to 44,000 cases a day, because that indicates that there's community spread. And when there's community spread out there and you spend some time indoors with people who are not going to be tested every day and know whether they're infected or not, then the risk increases. So that's what I would have hoped we could avoid, was going into the fall and winter at a very low level of community infection. Unfortunately for us, Peter, that's not where we are right now today.
Right. And so wouldn't this inform messaging on classrooms and restaurants if as we do send students back in, and we do start opening restaurants next week in New York to 25% capacity? Shouldn't these restaurants be encouraged to open windows and waste some energy cooling the place if they have to, but get some cross circulation going on in that room?
I do believe that. I think anything that has airflow out, not airflow in the room,
right?
But airflow out, name movement of air. And it's amazing how you can do that. I mean, if you can,
one window can make a huge difference.
Exactly.
And to colleges, I mean, you and I went through AIDS. We went through all the debates about public health messaging on that. And I think we all came to, going through those decades, we all came to a real appreciation for, and we're all believers in the quote unquote harm reduction movement,
Right.
From a public health perspective. Public shaming and just wagging your finger and saying, people need to do this or don't do this, that usually doesn't get you very far. You kind of, if you realize people are gonna mess up to a certain degree, and it always happens. You set up your public health policies to try to work around that and to reduce the harm that can happen through that messing around. So for like for people who were IV drug users getting HIV by sharing needles, give them, don't try to say don't use drugs because they're addicted. Give them a supply of clean needles so that at least they don't get HIV. And that's proven to be massively effective. As we had these college students coming back to school, we knew that some of them were going to start partying. And just saying don't party was foolhardy. So I think college administration, we've seen some of it. I think it was one of the schools, maybe Villanova, outside Philadelphia. They set up their main lawn there, their grass. They set up a late night, all day pavilion things with fires going and to keep warm, and where the students could socialize outside. I mean, if you take it a step further, I'd put a bar right there. Because if they're going to drink, you don't want them retreating from the cameras, going into dorm basements or dorm rooms, which is probably a lot of what's happening now. You want them to reduce the harm, to get outdoors and do it there. Correct?
Peter, I agree with you because I'm flashing in my mind a quick frame computer of years ago, how difficult it is for society to accept harm reduction. Yeah. And then when you accept it, you realize, why didn't I do this before? I remember so much the issue of don't distribute condoms because that's going to make people have more sex. No, nonsense. People are going to have sex, period. They're either going to have sex with condoms or without condoms. So you might as well give them a condom. The same thing with needle exchange. That there comes a point where you've got to accept human nature. So I don't know how that's going to roll out with COVID. We have good experience from HIV, namely the two examples that we've just brought up with needles and condoms. What acceptance that's going to be, I don't know. But right on, it's going to be taken out of context.
Yeah.
Because we're going to say, if we say, we know you're going to party outside, invest in some of those outdoor heaters that some of the restaurants have, open up a bar, have people wear masks, take your mask off when you're drinking, but keep the mask on. Mm-hmm. And you could meet, the cute guy or girl who now just registered and is now in school. Mm-hmm. That likely would work more than saying, all right, I want everybody to go inside in your own pod room with 3 or 4 people who've been tested. That's going to drive people nuts. So I think the only way you're going to see acceptance of that is that there are going to be some schools that do it. And then when the data come out, you're going to find out that school probably has less infection than the school that said don't do anything. And in a clandestine way, everybody went into somebody's basement in a dorm and had a big party.
Yeah, exactly. And in a sense, it informs some of our shaming politically both ways. The early the early demonstrations from kind of the Tea Party crowd pushing states to open up, first thing I thought of, oh, yeah, they're not wearing masks, but at least they're outdoors. We have not had a single super spreader event outdoors, correct?
Right.
Super spreader being one person, highly infectious, maybe asymptomatic, transmitting to a dozen or more people. All of those have been indoors. So the change between outdoors and indoors is huge. MAGA rallies, indoors, Trump has a rally, terrible idea. But he's doing more and more of these rallies in an open air hangar at an airport or outside. I'm okay with that. I think they should be wearing masks, but there's no super spreading going on at an outdoor MAGA rally, correct?
Yeah. What gets people politicized is when you tag a name to the rally.
Right.
Like, if you say MAGA versus Black Lives Matter versus
Right.
all that sort of stuff. If you just make a general statement, the way you've made, it's absolutely true. Right. If you have to get a group of people together for whatever purpose, do it outdoors. If you do it in a semi-indoor, make it modified indoor with an incredible amount of airflow, right, and wear a mask. So I don't care what the rally is. I think those are the kind of principles. When you start naming it, then all of a sudden everybody gets their red flag up and they take sides on that.
Yeah, yeah.